Hey, good morning, Doc. This is a case that you were inquiring about with regards to some palate expansion in the adult. Uh, the patient Dan has been, rather compliant, but I'm not sure if he's been compliant with the upper expander. We definitely see good good compliance on the lower arch. So let's switch over to that real quick. Uh, he's definitely got good leveling of the curve of Spee. The lower anterior crowding looks a lot better. So let me bring up, this is his before. So I'm looking at the crowding here. That's pretty obvious, but I'm also looking, are we uprighting these teeth back here to keep up with the expansion on the upper arch? Um, Maybe a little bit. Hard to tell. I wish the Invisalign software had, or at least the iTero software had the ability to superimpose and show the befores and afters. Um, that does exist in the time lapse part of iTero, but I'm not sure how to get over to that. So I think that this case might be a good one to have that time lapse feature put in so that you can see the befores and afters. So essentially, you can compare two different clin checks to each other, or so I'm sorry, two different scans to each other to see where the movements have occurred in three-dimensional space. So the lower arch is looking good. I'm sure the patient's rather motivated, but really what we're trying to do, because he's an airway patient, was expand his upper arch. Um, in a nutshell, I don't think we've gotten that much expansion. And the reason I know that is I select the two iTero scans and then I toggle back and forth. So this is before I'm looking at the intermolar width. I don't really see a whole lot of change there. Just to get a sense of where he started, I opened up his clin check, and he started around 30 millimeters. Again, our goal is somewhere above 38. If we can get to 40, great. Patients like this, we'd be lucky to get 35, 34. 4 millimeters of expansion is a lot. But the question is the patient tolerating this upper expander, and is he wearing it as much as we thought? So maybe we just should go to aligners at this point. We did our best with the palate expander, and it didn't work. With that said, let's answer the question, did we get any expansion? Maybe the expander wasn't being worn enough. Maybe it wasn't the right expander. Should we try to do this with SARPI or MARPI, some sort of implant fixated appliance which has a lower profile? So these are questions that we should ask before we just jump to clear aligners. So here was the beginning, and here is where he is now. I'm looking at the canine to lateral incisor. I find when I expand, this improves. I've also had expansion where anterior crowding improves, where there's no direct force on it. Just kind of clearing out the arch form posteriorly gives the anterior teeth the space they need to naturally kind of float into alignment. I have two cases in which it's rather significant that I'll show you if you're interested. The point being, when we expand, sometimes we see improvements with the anterior teeth, even though that force isn't directly on there. So I'm looking here compared to here, and it looks like we're starting to get some clearance, which is good. And when we expand, we decrease overjet, so that's an important thing. Posterior expansion creates a I don't want to say shorter arch length because the arch length is maintained, but when we expand posteriorly, the anterior posterior distance of the entire arch is decreased. And that's true in orthodontics front to back. It just has to do with what happens to an arc when you push sideways on the outer extensions of that arc. The apex of that arc is going to shorten. So always remember that when you expand, you're going to decrease overjet. When you expand the upper arch and lower arch, yeah. So when you expand, you run the risk of changing the anterior posterior dimension. I don't really see a whole lot of change here in that space. Maybe a little bit. Maybe we see a little bit of tipping of these teeth here, which is what we would expect. So in a nutshell, he probably got 5 to 10% of the expansion we were hoping for. Better than nothing. The question is, do we want to modify and move forward? And obviously, you know your patient the best, so I'll let you go from there. If you do aligners, just keep in mind that you're not going to get skeletal expansion with the aligners. We might improve these teeth in relationship to each other, but it's not going to be as ideal as it would have been had we done skeletal expansion. With that said, he's looking better. I'm sure the patient's happy. Keep me posted on what you do. Take care.